All right, thank you, Danielle. It's a disease that impacts only kids, and some medical experts say it could be related to the coronavirus. And joining us this morning via Zoom is Dr. Hemmal Kothary with Dignity Health Mercy Memorial Hospitals. Thank you for joining us this morning. Appreciate it.
Oh, thanks for having me, Mike.
Can you first begin by telling me the distinction between Kawasaki disease, which we're seeing pop up and a lot of people are talking about it, and COVID-19?
So Kawasaki disease is a type of a disease. It's the name of a disease that it's primarily in kids. We don't know what causes Kawasaki disease. We believed it was a virus or a bacteria. COVID is now causing similar symptoms. So more and more of us are now believing it's a virus that actually causes this disease.
Now, we haven't had a case right now of Kawasaki in Kern County, have we?
No, we have not.
And you told me that you did, though, experience or see it firsthand a while ago?
I have seen a case of Kawasaki disease 20 years ago when I was at Kern Medical Center. And it's pretty dramatic. You see these young kids, and it's usually younger than the age of 5 coming in. And what you see is that first thing they have is a high fever. And then you see their eyes are bloodshot. If you look down, their lips are always cracked. Their tongue looks like what we call a strawberry tongue. It's bright red and it's got little white spots on it. And then the other thing, the real other clinical thing that you notice is their hands are swollen. We call them sausage fingers. They're really swollen. Their hands and their feet are swollen. And then they move into the next phase is they start getting peeling of their skin, it's all due to an inflammatory state that this disease causes.
Now, how close is this to COVID? How similar are these symptoms?
So the symptoms that we're currently seeing in some of the kids back east are very similar to Kawasaki. And, the biggest issue with Kawasaki is not just the inflammation, but it causes inflammation at the heart, and it causes aneurysms of the vessels of the heart. And that's what we're seeing in kids back east as well right now.
Let's talk about some of the other things that are happening right now. In fact, just yesterday, the county announcing that they got the go-ahead to begin sort of moving into the second stage of phase 2 as far as reopening goes. Restaurants, dine-ins will begin today, probably. Just your reaction to it. Are we moving too quickly, or are we kind of right on track?
I definitely think we're right on track. I don't think we've moved too quickly. I think we've figured out what we need to do. One of the things we had to make sure we had in place is ample amount of space in our ICUs at our hospitals. Just in case we opened and we have a surge, we can go ahead and take care of these patients in our ICUs. So we have allocated 25% of our ICU beds currently in all of our hospitals to make sure we're ready if there is another surge.
And obviously, let's talk a little bit about not only the restaurants that are going to begin that dine-in portion of it, a percentage of their dine-in area reopening and making sure it's sterilized, but also you need to send out a reminder as well, wouldn't you, to the people that go there to also continue to do some of that sterilization practices they've been doing?
Right. And that's the two things that we've learned from this pandemic is, one, the social distancing piece really helps. And the second is our hand hygiene. We've been taught about hand hygiene since we were little kids. And, we've somehow forgotten how to do that. So we need to keep practicing that. If we do those two things, we will limit the cause of the surge.
Always wash your hands. Dr. Hemmal Kothary of Dignity Health Mercy Memorial, thank you so much for joining us this morning. Appreciate it.
Oh, thanks a lot for having me, Mike.